Good morning. Welcome to the Community Voice. I'm Steve Raddick, your host. Delighted to have you with us on this beautiful Monday morning. I hope everyone had a great Turkey Day, time of Thanksgiving with family and friends, etc. And now we're into the Christmas season, and so hopefully things will be good for one and all. We want to thank our sponsor, Tanner Health System, for their sponsorship, and we thank you most of all for listening. You can find us on News Talk 1330 Facebook Live today, and we also are found on 106.3 FM, 1330 AM, and on the website, etc., etc. You can call us 678-601-TALK, 678-601-8255. We're honored to have in studio Marcy Heath of Insurance Solutions and Innovative Solutions. Good morning.
Good morning.
Well, we've been doing this now for over a decade.
We have.
It's been fun.
It has been fun.
The topic pretty well is not my my favorite, but it's just been good to see you once a year. We properly and appropriately sounded the warning of Obamacare before Obamacare became Obamacare.
We did.
And nobody listened to us.
They didn't.
So, but that's just standard. I'm used to that. Anyway, let's start out. There's a lot we want to talk about. We want to talk about you've got contributed to a new book, Next Generation Healthcare.
Yes.
And we want to talk about that. But first, let's get the latest on where we are. I referenced Obamacare. I think open enrollment is underway.
It is.
Where just bring us up to date on open enrollment. I think it's going to be closing pretty soon.
It is. So open enrollment began November the 1st, and it ends December 15th. So we have 4 insurers that is remaining in the exchange. Blue Cross and Blue Shield re-entered some of the rural areas. They will cover 75 counties. That kind of dropped back a little bit. They covered 85 counties in 2018. So they have scaled back a little bit, but they are going into some of the counties that they were not in last year. So some of the counties that surround us that are affected, are not effective, but I guess they have access to Blue Cross and Blue Shield now, is Polk County, and then also Douglas County, and I believe either Bartow or Paulding County has access to Blue Cross and Blue Shield. So your average rate increase this year is less than 4%, and that is with that's pretty much across the 4 carriers. The insurers are adding the cost of the cost share reduction to Silver Plan rates for 2019. Some on exchange and some off exchange. You've had nearly 5,000 or 500,000 enrolled in 2018. Enrollment dropped 16% in 2017, which was more than the national average. 2018 Georgia Marketplace coverage fell 2.6%, and the national average was 3.6%. So for this year, of course, Haralson and Carroll counties just has access to Blue Cross and Blue Shield, which is the same as what we had last year. Polk County has access to Alliant and Blue Cross and Blue Shield. So basically what we're seeing this year is Blue Cross and Blue Shield had, I think it was like a 0.3% rate increase. But then you have your subsidy that comes in and pretty much kind of averages or takes over that rate increase. So you remember when the marketplace just came about or opened,
right.
What was it, in 2013, 14,
Uh-huh.
and we had 0 premium.
Right.
We're back there again.
Okay.
So we've got several people that well, not several. We've got a lot of people that are getting 0 premium this year, and Alliant, which of course we don't have Alliant, but Polk County does. Alliant had a 10% decrease. And then you've got Embetter, which Embetter basically broadened their coverage and their counties. They had an 8.8% increase, and then Kaiser was the carrier that had the largest increase. They had a 14.7% increase, but if you average them all together, it was about a 4% increase. So we've had a lot more interest this year, just because we've advertised, about the zero premium. So of course anytime you have zero premium and somebody can get something for free, you have a lot more interest in getting that. Now, come next year, you don't know what that's going to be, so it's basically a year-to-year thing on the individual market.
Now, I thought Blue Cross Blue Shield was changing its name.
It is. I think it's moving over to Anthem Blue Cross and Blue Shield.
Why? They got bad PR or what?
Don't know. I don't know.
Let's stay on this for a minute and pull out your crystal ball. It looks like Obamacare is here to stay. Which is the foundation for socialized medicine. The Republicans didn't repeal it, and certainly the Democrats are not. So, for example, I understand the Cadillac tax, however, was postponed to 2022.
Right.
Correct. So, little by little, the full-fledged Obamacare will be implemented.
So, you've got parts of it that have been. It's like little pieces have been kind of dismantled, but the whole thing hasn't been repealed or replaced. So a lot of, like I had somebody in my office last week, and they were talking about, so like when you file your taxes this year for 2018, if you don't have insurance, if you can't prove that you've got insurance, you still get fined for 2018. But after this year, for this is for 2017. For 2018, I guess, when you file your taxes, there is no penalty for not having insurance. But here's the crazy thing. So the law is that you are supposed to have insurance. So the mandate is still there. The law is still there that states that every American is still supposed to have insurance. The problem in it, or it's not really a problem, I guess, for us that choose not to have insurance, is that you're not fined if you don't have insurance, or you're not penalized. So my client was like, so it's basically like having a speed limit saying, okay, you need to go 35 miles an hour, but if you decide to go flying down that road at 65 miles an hour and you get caught, nothing's going to happen to you. And I was like,
ticket.
Yeah,
but
pretty much.
It won't take them much to reinstate the ticket. That's just a matter of Congress or the next president or whatever.
Well, that is true. And considering the way that midterms went.
You're right. We can see that.
So
basically, my
statement. Anything past it.
Yeah. So my statement is it's here to stay from here on out. So we've got full, greater as time goes on, but full socialized medicine in the future.
Yeah.
Tell us about where we are in terms of the cost of insurance for most everybody. We hear so much about, and I think I read it was like 10% of the population now has deductibles that are like $3,000 or more.
Or more.
Yeah.
So. The cost of insurance goes up because the cost of care goes up. You cannot contain the cost of your insurance until you contain the cost of care. And so that's something that we're really implementing and that we're really educating our clients on, is that for you to be able to contain your health insurance cost, and this is more on the group side than it is the individual side, is you need to implement cost containment tools, especially for your employees, to be able to find the lowest cost facilities, the lowest cost doctors, and by doing that, then of course you keep your claims low, and by doing that, you keep your insurance low. And of course, we can go into that.
Okay, well, we'll do that. Let's take a break. We're going to come back and talk more about the cost of care. Talk about something called reference-based pricing, right?
Yes.
And you may see on the desk here Marcy's book, Next Generation Healthcare. You can find this online at News Talk 1330 on the Facebook page, or you can just simply call us, old school, 678-611-TALK. We'll be back with more after this.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host. Honored to have in studio for our annual get-together, our annual insurance powwow, Marcy Heath of Insurance Solutions and Innovative Solutions. And we're going to ask her, what in the world does Innovative Solutions mean after her? But first, let's talk about the cost of care. I mean, this is always, whether it was Hillary Care or whatever it was always the premise that costs were skyrocketing. America's spending more than any other developed country.
And that's not true.
That's not true? You mean that's not true?
No.
Well, tell me why.
So if you look at the statistics, and if you look at all the information that's out there, the United States, as far as the utilization, we don't use any more care than what any other country does. The problem is that our cost is more than what other countries are. You've got more in administration cost. Our doctors are paid more. Our cost is just more. So again, that's, as care cost is more, then that's passed on to insurance. Insurance cost is more. So as I was saying, as far as us, educating consumers, if you can go to a hospital and get an MRI, it's going to cost you $3,400. If I can send you to Noonan and get an MRI, and it costs you $400, yeah, you might have to drive 30 minutes down the road, but wouldn't you want to spend that 30 minutes and save $3,000?
So what you're suggesting is cost of care is not more government, but more competition. So
Right.
you reference in your book something called reference-based pricing. So how does that work?
So reference-based pricing is it's not new. It's just it's not new. So if you think about the way that insurance worked, like way before the whole PPO, HMO models came in, we didn't have networks.
Mm-hmm.
We didn't have $5 copays. You basically had insurance to where you had a deductible, and you may have had co-insurance, and you paid everything out of pocket. It worked just exactly kind of like your car insurance. You were responsible for everything until you met your deductible and co-insurance, and then your insurance paid 100%. And guess what? You could go wherever you wanted to go. You weren't restricted to a certain network. So Americans got so wrapped up into PPO networks, and so now every employer that I walk in, it's like, oh my gosh, we have to make sure that Sally's, doctor's in this PPO network. Okay, why? Why do you care if Sally's doctor is in this network? Because all that PPO network is what is it giving you a discount off of? Okay. So these discounts, these PPO networks are so inflated, you never know where that starting price is. If you go in for a knee surgery and you call that hospital and you say, hey, I would like to know what my cost is going to be for this surgery, you're never going to know. Nobody's ever going to tell you what the cost is. You know when you're going to find out what that cost is?
Weeks later.
After you have that surgery done and you get your EOB, and then you have that price of what they charged you, what was written off, what went towards your deductible, what went towards your co-insurance, patient responsibility. So reference-based pricing is you know exactly where you're starting. Okay, so you're not starting up here and trying to work your way down. You're starting here and you're working your way up. So reference-based pricing is starting at Medicare, and then you work your way up. So Medicare, you usually pay about 150, 200% above Medicare.
Well, now this is an opportunity for businesses, is it not, to
It
take
is a fabulous opportunity.
Okay.
Yes. I have written so many cases implementing reference-based pricing. And then, of course, we also implement another great cost containment tool, which works coincide. It's basically kind of like a glove for the reference-based pricing, because it is kind of like a new model to where your doctors and your hospitals and your ancillaries are not really kind of used to it. So we implement a third-party medical management, which comes in and they help the patient, and they also help the doctor's office, the facilities, to be able to navigate, to kind of educate. So the plan runs smoothly.
So those savings would be immediate.
Yeah.
Yeah. Okay. So in effect, what you're saying is the free market could still reverse this process. And we're
doing it on a daily basis.
Okay, and what's the
case by case?
What's the first step for a business if they would like to proactively engage in this?
So there are.
And what size of business is this? Does it apply to every size or just the big boys?
So we do have one or two carriers that will do reference-based pricing on a smaller group, and they will go down to, I believe, 5 lives,
wow.
5 enrolled lives.
That's virtually everybody.
But once you get to like 50 enrolled, and that was the reason why I have separated and I started a new company. We've got Insurance Solutions, which we've had for a while. Insurance Solutions is, serves our individual market, our Medicare market, and then our small group market. And then Innovative Solutions serves our large group market. Anything that is 25 to 30 lives, and then all the way up to 10,000 lives. Because that space is such a unique space, and we're able to do so much more as far as basically building the plan unique to what the client wants and what the client needs. So it's two totally separate companies because it's two totally separate things. Basically, Insurance Solutions of the South, you're still working off of commissions because you can't really strip your commissions out of there. And then Innovative Solutions of this we work off of fees. We don't work off of commissions there.
All right, we're talking about the cost of care with Marcy Sanders Heath of Insurance Solutions and Innovative Solutions, and we'll be back with more after this word from Tanner Health System.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Good morning. Welcome back. We're talking about the exciting subject of health insurance. Yeah, right. One of my favorite topics. And we're talking with Marcy Heath of Insurance Solutions and Innovative Solutions. She's got a portion of the book, Next Generation Healthcare, which hopefully you can see on Facebook Live. And you can contact Marcy where? Let's get that in before we get...
So you can contact me at 770-537-5300, and we are located in Bremen.
We're talking about reference-based pricing, and how does that relate? We talk about the big insurance companies. I think the big ones are Blue Cross, United, Cigna.
So you have Blue Cross, United, Cigna, Aetna, and
Humana. And basically, if I'm wrong, and correct me if I'm wrong, they pretty well sold us down the river when Obamacare came along.
They did.
Yeah.
If you look at their market share from the day that Obamacare was implemented, or the Affordable Care Act, they have done nothing but skyrocketed since.
Mm-hmm. In terms of profits.
Yes.
Mm-hmm. Mm-hmm. So how does reference-based pricing put pressure on the insurance companies to contain their costs?
So reference-based pricing, it basically puts pressure on them to do something to try to be innovative, mm-hmm. to try to bring something new, to bring something fresh, to try to be innovative. But the problem with the BUCAs is that they're not innovative, and they're not going to bring anything fresh. I sat down with a CEO of a company I guess it was last week, and talked to him about some of the ideas that we're doing with the large companies. And I was like, we've got a way to to be able to take these large claims and for the prescriptions and to get them from not hitting the claim cost, and we can farm those out somewhere else. What do you think about that? And of course I got hit with, this is why we can't, this is why we can't, this is why we can't, besides listening to the innovative ways and the strategies that we're doing and that's working all across the United States. I get hit with, no, we can't do it because we've always did it this way. And and like their company uses Express Scripts, which is a PBM, and it's like one of the most expensive PBMs out there.
What's a PBM?
It's a prescription drug manager.
Okay.
So, and that's one of the things, and that's why you see a lot of the insurance carriers and buying up like Express Scripts and
And even I think CVS, the large pharmacy chain, bought up what was it, Aetna or somebody?
Yeah.
I think it was $69 billion or something.
And that's the reason why you see that is because they make so much money off of the rebates,
mm-hmm.
and so it's profitable for them.
But basically, you can contain the cost when you talk about the cost of an MRI or colonoscopy or whatever. But you also going to have to contain these insurance costs in some manner or fashion if you're going to bring this back into the free market, right?
So when you contain that cost, when you educate your consumers to be to go and to find that quality care, that's kind of the perception that we all have, is that the most expensive things is quality, and in most things that is true, but not in healthcare. Okay. So if you look at the statistics, your most expensive health care, if you look at the quality, it's usually not quality. Usually your less expensive health care is quality. So we educate consumers, and as you educate consumers to go find the lowest cost quality care, and you can implement a transparent PBM to where the employers are getting, the rebates and the money back, and they see where their claims are being spent. All of that is bringing your insurance costs down.
And for the employer, that's just simply good business for the.
That is, yes, because if you're in a fully insured plan, or if you're in a self-funded plan and you have no cost containment tools, or you don't know where your claims are being spent, you're basically just renting your insurance for a year, and you're just basically throwing that money down the drain.
Right. And so basically, if a business person is looking to ways to become more efficient and yet also enhance the working environment for the staff, then this is a way to go.
Yeah. I mean, like a fully insured plan, or like even a or a level funded plan, and you're not teaching your employees how to be like good consumers, you're basically handing them a company credit card, because all they're doing is going and using that card to the doctor, to the hospital, to the this, to the that, and basically what that's doing is that's racking up claims, and then at the end of the year, guess what? You're getting a renewal. And so your insurance cost, your employees' insurance cost, is going up every single year.
All right, we've run out of time. Tell us again how to get in touch with you, and we've got to say Justin Richards, who's always a guest on this program. We're going to bring him back soon, I'm sure. He says he loves his insurance agent. So,
Aww.
isn't that sweet? But
he's been a client for a long time.
How long? How old is Justin, by the way? But anyway,
I'm not going to tell you that.
Okay, good. All right, how do we get in touch with Insurance Solutions and Innovative Solutions?
So you can reach us at 770-537-5300.
All right, and I guess I'll see you in a year. We'll do it again.
Yeah.
Yeah, I think we're in year 11 now.
Yeah.
Yeah, okay, good. We'll have a 20th anniversary party. All right, well, thanks to Marcy Sanders Heath for coming in. Thanks for listening to Community Voice, brought to you by Tanner Health System. Go out and make it a great day. You're in tune to WLBB Carrollton.